I remember my time as a pharmacy intern. One day during cough and cold season, I was working at one of my favorite stores. It was in a black neighborhood, and a lot of my buddies from high school and members from my church came there. "Marvin, get the counter," the pharmacist said. "Sure," I replied. This pharmacist never waited on any of the patients at this store. So as I'm looking at the computer, looking at the patient's order, she's here to pick up a prescription for her son, it's cough syrup. 1 second, ma'am, I'll go to the back and finish it up. So I went to the back of the pharmacy to finish up the patient's order and realized we didn't have enough to fill it. So I went to tell the pharmacist, and the pharmacist seemed very annoyed. He then said to me, "Just put some water in it." My eyes grew wide, and I said, "What?" He then replied again, voice a little lower, still calm, "Just put some water in it, it'll be fine, no big deal." Oh, he was actually serious. Now, the proper procedure in a pharmacy is when you don't have enough to fill a patient's order, you give them a partial or a portion, and then when you order it, and you give them the remainder when it comes in. To make a long story short, I did not put water in that child's prescription that day. But later on that night, I struggled with why the pharmacist felt so comfortable making such a request of me. First off, he never waited on any of the patients at that store. Second, he was extremely annoyed, it seemed, while working at that store as well. Third, he wasn't as helpful at this store as he was at other stores I worked with him at that did not compose of black and brown people. But then, he never treated me poorly. What was it? Was it the fact that I was a pharmacy intern and he saw some portion of himself in me? What was it? Bias. Although this is an extreme example, implicit bias is real. It can show up indirectly or operate subconsciously. Furthermore, implicit bias are feelings. Feelings we have against a certain culture or group of people. But unlike feelings, we cannot hide these biases because they operate subconsciously. An article in Time magazine by Jennifer Eberhardt asked the question, why is it implicit bias just not racism? Well, when we think about racism, we think about bigots. And you don't have to have a moral failing in order to have an implicit bias. Now let's fast forward. Years later, I am now a pharmacist. On the weekends, I played semi-pro football with the local team. I knew I was getting too old to be out there, but you couldn't tell me anything back then, and I was a beast. Well, one weekend, I ended up dislocating my shoulder. I actually worked that next day, arm in a sling and all, and I had the doctor calling my pain prescription to another pharmacy. So when I got off work that day, I went to the pharmacy to pick up my pain prescription, and as the pharmacist is ringing me up, I'm looking at my bottle, and I notice the day's supply is wrong. The doctor said he was going to call in a quantity of 30. There was only 10 in this bottle. So I had the pharmacist go check the prescription. He went and looked at it and said, "That's what your doctor wrote for." And as he starts to come back to the counter, he starts to smile and says, "You won't need that full prescription. You people take pain well." My eyes grew wide, and I said again, "Excuse me?" I actually think that pharmacist thought he was giving me a compliment. When he realized my reaction, he tried to backpedal and say, "You're a big guy. You won't need that full prescription." So the next day, I got my prescription taken care of. I called my doctor, got it all straightened out. But it wasn't until later on that I realized there is this belief between African Americans and assumed pain tolerance. An 2015 article in JAMA looks at 1 million emergency room visits. These emergency room visits are children admitted for appendicitis. The study goes on to say that only 1/4 of the black children actually received opioid painkillers compared to the white children admitted for the same reason. The article also goes on to say that healthcare providers can contribute to unequal treatment to minorities as well. So let's look at this picture. Can you see the physician, let's say, diagnosing the patient for pain? Do you think this doctor can clinically or effectively manage this patient's pain with this invisible wall of implicit bias in front of him? Now let's look at it from the patient's perspective. What kind of negative experience? What kind of emotional toll? What kind of distrust now does this patient have for this doctor or healthcare professionals in general? So, what is society doing to fix this issue? With extreme examples such as the death of George Floyd, there has been an increase in education specifically around diversity, equity, and inclusion. Implicit bias is one aspect of that training. This education has forced government systems to look more closely at policy. Racism as a public health crisis was a resolution or an announcement that looked at the disparities in the education, criminal justice, and healthcare systems. Now let's look at our pharmacists that I discussed earlier. Could they benefit from some education in diversity, equity, and inclusion? Some may actually say, let the employers handle diversity, equity, and inclusion training on their own watch. Well, let's see what that may look like. Emily's Law is 2009 legislation in the name of Emily Jerry, a 2-year-old that died from a pharmacy technician error. Before this law, a pharmacy technician could work in anybody's pharmacy without any mandated training. What this law did is it took the training away from the employer and made a pharmacy technician have to pass a board-approved competency exam. 2017 journal, in the Journal of Psychiatric and Neurologic Pharmacists states that healthcare professionals exhibit about the same amount of implicit bias as the general population does. This implicit bias could affect diagnosis and treatment. The same implicit bias that took the lives of Breonna Taylor and George Floyd that shows up in law enforcement systems can show up in our healthcare systems. So what can we do? Currently in Ohio, a pharmacist must report CEU every 2 years. This CEU is composed, or continuing education is composed of pharmacy law and pharmacy practice. Well, what if it created some diversity, equity, inclusion training as well? A 2019 article in the Journal of Infectious Disease states that just as healthcare professionals are expected to stay up to date on medical techniques and clinical guidelines, we expect them to be up to date on cultural competencies as well, to make sure that they're able to treat people that may not always look like them. So, with that, I believe that it is time. Go to your pharmacy board organization and suggest diversity, equity, inclusion training for pharmacists every 2 years. How? Just go to the website. They welcome your comments and questions. I believe that it is time to go to your state representative and propose a bill that would mandate a pharmacist to have diversity, equity, inclusion training every 2 years. I believe that it is time. To all my fellow pharmacists, reach out to your local pharmacy organization and have them support legislation that would demand diversity, equity, inclusion training for a pharmacist every 2 years. And the next time you go to one of your pharmacy organization meetings and there's some type of implicit bias training there, make sure you take it. Be a part. Make a change. Thank you.